want to talk to you about esophageal irritation, esophageal strictures that you've been diagnosed with, and why using an antacid, a proton pump inhibitor, is really not the answer. It's certainly not the answer long term, and we'll talk about the dangers associated with these drugs, but the fact that it's really not difficult to heal this problem naturally. So let's jump into it. The esophagus is the tube that connects your mouth to your stomach, so your food goes down that tube and enters the stomach. The stomach is a bag of acid, that is its job, and it's supposed to churn around your food and break it up. But what it's not supposed to do is get so irritated and compressed that it shoots the acid up your esophagus. Your esophagus is not designed to be bathed in acid. If you've ever vomited, you know that feeling of the burn, and it's a very inappropriate, unnatural thing to have happen. But with patients that have acid reflux and have this irritation to their stomach, that acid is going up and down the esophagus pretty frequently, and that results in a lot of irritation. Now, your esophagus is a tube that's only 1 inch in diameter, so it doesn't take a lot of that corrosive acid to create a lot of inflammation, redness, swelling, so that essentially the esophagus narrows, and that's where the stricture aspect comes in. And patients can have trouble swallowing, they can have regurgitation issues. It's pretty miserable. So on the face of it, if you're a patient and your doctor says, listen, your esophagus is really irritated, we're going to put you on this drug that prevents the stomach from making so much acid, and then your esophagus can heal. You know, and said quickly like that, you're like, oh, yeah, good idea. That sounds good to me. However, and this is a big however, this is unnatural. What's unnatural? You're diminishing the amount of acid your stomach is making instead of finding out why is the stomach being compressed and bringing the acid upwards. Because the stomach is designed to be a bag of acid. It's very critical that your stomach is a bag of acid because it's the first part of digestion that occurs in your body. And we'll talk about the dangerous short-term and extremely dangerous long-term side effects of taking PPIs. And this you need to know, most especially because it is so easy to get to the root cause of why the stomach is being compressed and shooting its acid up the esophagus. This is not hard to fix. It's a natural solution. Before we jump into the solution, let's look at the side effects. Now, there's a long list. I'm going to look at my notes a little bit. So the short-term effects are very associated with a lot of the symptoms that we see with hiatal hernia syndrome, which are diarrhea, constipation, nausea, abdominal pain, bloating and gas, dizziness, and then additionally there's fever and headaches, which are not as common with hiatal hernia syndrome. But imagine you have hiatal hernia syndrome, you've got this pressure on the stomach, now you take this medication, it's making all of those symptoms worse. So truly making you miserable. And you have to have experienced some of these things to know how miserable it can be to have a lot of bloating and gas or a lot of constipation or diarrhea, dizziness. It's a miserable experience. It's very hard to enjoy life and really live life to the fullest when you're feeling this way. But hold on, let's go to the long-term effects. Now, long-term, we're looking at around 2 years of taking these medications, which if you've just gotten on them might sound like a very long time. However, I regularly meet with patients who have been on these for several years and decades, literally decades plural. So this is serious. The long-term effects include infections, particularly a bacteria called Clostridium difficile, often abbreviated to C. diff, which can be life-threatening. Nutrient deficiencies, magnesium, B12, and iron, which are also serious. Kidney disease, a type of kidney disease where patients have no issue with their kidneys, get on these medications, and there's this insidious change in their kidney that by the time the symptoms occur, the kidney damage is very severe. So that's a serious one. Dementia, and this is, there's so many things we don't want to have, but dementia, the research associated with this correlation with PPIs is very strong. And it's known but not talked about, which is really unfortunate. Bone fractures, so you get weakened bones. People as they get older, if they have like hip fractures, it shortens their life very precipitously. Severe diarrhea and stomach cancer. So here you are being given this medication that's supposed to be sort of giving your stomach a break from making this evil acid, even though that's its job, so that your esophagus can heal, and long-term effects are stomach cancer. So I think you can agree that this is a long list of serious side effects. So you go, okay, but my esophagus needs to heal. Let's use a little common sense here about what the solution could be. Remember, your stomach is supposed to be a bag of acid. That's its job. The issue is that the stomach is being compressed. We call it increased intra-abdominal pressure, just meaning there's more pressure being put on the stomach. And because it is a bag, it has no choice but to shoot its contents, acid, up your esophagus. So that's the issue. But again, stomach is supposed to be a bag of acid. So what really is the problem? The stomach making acid? No. The stomach being compressed. That's the problem. So we simply get to the source of this increased intra-abdominal pressure. And this has to do with other aspects of digestion, looking at your small intestine and your large intestine and your liver and your pancreas, looking at all these adjacent organs and their function and sources of inflammation that are creating this pressure. And when we get to the root cause of the source of the pressure and relieve it, the stomach relaxes and it's no longer having to be compressed and sending its acid up your esophagus, and your esophagus heals. So would you agree? This is the better way to do it, is to just naturally let the stomach continue to do its job making acid, but get to the cause of why it's being compressed. It seems so ridiculously, sensical. Common sense would dictate this makes sense. And it works, okay? But one thing if it was just an idea. We've been doing this for 40 years, but treating hiatal hernia syndrome for 25 at least. And it works and it's natural. So if you've been on a PPI, if you're worried about your esophagus, this is a solution and I'd be more than happy to help you with it. Give us a call and we can perform a consultation.